Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 11, Episode 4 of the Function with Purpose podcast. Thanks for joining in. I am Dr. Amy, hosting of this podcast, and I appreciate you hopping on. Okay, main topic, quote. This actually was from a patient interaction. I'm going to get heated on this. You're the perfect candidate for surgery. What? Really? I'm the perfect candidate for surgery? So I've been working with this particular patient probably for about 6 or so months now. And she's a bit older, but definitely recognizes that it's very important for her to stay active, especially with what she has to deal with on a daily basis with her body. She is honestly living in chronic pain and now finally taking the initiative to really, really dig down deep to help herself. So, when someone experiences this, quote, chronic pain, this is just my particular opinion, something is wrong, or there's an issue with how your body moves and the way your brain and nervous system relates to it and how it interprets that. Somewhere along the line, there's kind of like a disconnect. So one may experience pain on a daily basis that it might flare up, and then they have to revert to medicine, pain medicine or muscle relaxers in order to calm it down. While on days that they feel good, they could perhaps push their exercise regimen or routine a little too far. But "you're the perfect candidate for surgery" came out of this spine surgeon doctor's mouth after my patient took the initiative to set up an appointment because she wanted to get an updated MRI, an image of her low back. And that's okay, because the last time she had one was like 5 or 6 years ago. So she wanted the details of structure to see what was going on in her back, because her symptoms kept getting better, and then they would worsen and stay around longer. And then she would have to revert to pain meds in order to sleep because the achiness in her hips and pain down her leg was happening. So for her mind's sake, she sought out a local spine surgeon, spine doctor, in order to get an image set up. So her last visit with this particular doctor, they went over her imaging. And if you've listened to some podcasts of me in the past, I will say, and I will repeat this, you are not your image. You are not what your image tells you. Period. Okay? Keep that in mind. Literally, as soon as my patient walked through the door and was in the patient room, right, the spine guy comes in and says, "Oh man, based on your image, you are just the perfect candidate for spine surgery. I guarantee you This will fix all of your issues, all of your symptoms that you're experiencing, because your hip is fine, which from a PT perspective, I knew it was fine because my patient and I literally talk to each other because she wants to understand what's going on. So she kind of sat there and pondered, and she was just like, really? Your first sentence that you say to me is, based on your image, you're the perfect candidate for surgery that I know is going to fix your issues. Side note, when in fact, when people get surgery on their back, especially their lower back, they have like a 50 to 70% chance of it not working as planned, which then sets up that patient for future multiple surgeries and then a spinal fusion in the future. We don't want that, okay? Now, after getting back to my story, my patient reported back to me. She came in for her physio session. She's like, you know what? I actually felt pretty good. Because the intention of me going to that office, besides him saying that, oh, I want to do surgery on you, I vouched and promoted, like, I want to get a cortisone shot in my back. Because what we're doing in therapy flares her up. And I think what we're doing in therapy won't help her get over the hump. So this is where perhaps directed medicine to the area that's in question will help calm the actual inflammation that's going on. Makes sense, right? So I already knew going in, I was like, okay, this is probably L4, L5, S1 level. So that's kind of that lower aspect of the small area of your back, like kind of right above your butt crack in your waistline, that L5, L4, S1 area or sacrum. L just means lumbar, and then the numbers next to it mean the level. Lumbar vertebrae number 4, lumbar vertebrae number 5, and then sacral vertebrae number 1. So the patient got 2 cortisone shots in her back on the right side because she was experiencing right leg symptoms and a lot of achiness into the right hip, which from anatomy, I knew exactly what was going on. So based on an image, people with this specific example, especially someone who is navigating chronic pain and figuring out the pieces on how they can maintain fitness, maintain exercise, maintain movement, do their activities of daily living, cook, clean, care for their grandchildren, drive a car, right? That it's very important for people who are kind of experiencing this chronic pain aspect and symptoms that they need to vouch for themselves, because I'll tell you right now, back surgery is not going to fix what's going on, because the success rate of back surgeries is like 50% or less. In fact, probably 30%. Which means if it's only 30% successful, you have a 70% chance that you're going to get surgery again. We don't want that. So it's very important that we find these little pieces, physical therapy included, in lifestyle habits. How's your water intake? How's your sleep? By the way, how's your resting heart rate? How's your blood pressure? You're monitoring your atrial fibrillation, which this patient particularly has some heart issues, right? She also has to very, very minute and detailed monitor her water intake. So, because unfortunately, she's starting to have some kidney issues. So, from the patient perspective, it's very difficult and very frustrating to be led down a path without the details. So I very much enjoy working with this particular patient because when she comes in for her session, she's like, now tell me, I really want your honest opinion. Why would the spine doctor say XYZ and not help me and tell me and guide me on protecting myself in order to avoid surgery? So, you know what I told her? I said, he's a surgeon. That's what he does. He does spine surgery. He doesn't tell you how to prevent one from getting spine surgery. i.e., here's where physical therapy steps in, right? You're here right now. And I'm helping explain to you, okay, this image, we see this MRI. Now, I'm not an expert in MRIs, but when we're in school, we do have a little bit of time commitment to looking at imaging. That, okay, I can see that L5 disc thing is kind of pressing on your nerves, and even the level above it, a little bit of that L4 is too. And that makes sense because that level tells me where the symptoms are in your legs, or in your leg, in this case, the right leg. So will surgery fix this? No, there's no fixing, there's only trade-offs, right? So if we can find a way, an inexpensive way, to literally self-experiment on the proper dose of physical therapy sessions and what we do inside of that, mitigating symptoms, getting some movement into the leg and the back, building a strong backside and back muscle, tying in your lifestyle factors, right? We certainly don't want to walk down that surgical route. Patients like you, as I was explaining to her, that I have worked in the past with, unfortunately, were led down the wrong path. But you're different. You're a different category of patient, right? You're not a surgical candidate because you know better. You're not a surgical candidate because you're here standing in front of me. You're not a surgical candidate because although your image tells you and shows you that your discs in your back are pressing on your nerves, that, oh my gosh, you have the worst back ever, that's not your mentality. Because you know that. You've been down that route before 10 years ago. You've been down that route 15 years ago. You've been shuffled around from doctor to doctor, and even previous physical therapists who perhaps were unable to answer the questions that you're asking me today. This is how we piece things together. Yes, okay, we got an updated image. Cool. Gosh, got that checked off for you for your mind's sake. But look at this. This is what I see on the image. I see some of these areas that I think we can make your back stronger. We can turn, literally, there's significant evidence where if we do a little bit of dry needling into the deep musculature of the back, this is me ranting, by the way, we can actually prevent the back muscles from kind of shrinking per se, right? It helps them kind of build strength. It prevents these, like, what we call these fatty infiltrations or fatty deposits to develop into the low back. Because if we see that on an image, and there's a lot of these fat areas inside the muscle, yeah, certainly that's an area that we need to help change. And there's strong evidence that electrode dry needling can help actually change the structure from a biology standpoint of the low back and essentially make those fatty deposits disappear. Because in muscle, we shouldn't have fat in muscle. It shouldn't be a ribeye, right? It should be a little bit of a New York strip, filet mignon type style, right? If you go ribeye or even a more fattier piece of meat, something's wrong there. From the physical therapy viewpoint, that's weakness. When there's fat inside of a tissue like that, especially muscle, that is weakness. Fat's not good when it's dumped in muscle. So she was like, wow, yeah, like That makes sense. All right. So, yes, an image might show, oh my gosh, she's the perfect candidate for surgery, but give the patient the details. Why? Why would you think I would be the perfect candidate? Because outside of this office, I'm staying as active as possible in order to prevent surgery. I'm going to get a cortisone shot and see if it helps. I have a 50-50 chance. Well, guess what? When she was in the office with me the other day, she said, oh my gosh, I feel great. I'm like, perfect. This is the window of opportunity to get you moving, to kind of drill in a little bit on that back musculature, to do a little bit more specified movement for the backside. Because if we can mitigate symptoms and open up an opportunity to promote exercise, movement, electrodry needling tolerance, maybe some cupping, getting on the echo bike or assault bike or the rower, doing some slight jogging and incorporating some type of strength component. When you're at physical therapy, boom, you just laid the foundation. That is the perfect window of opportunity to help patients lengthen the experience of chronic pain staying around. The more that we can do that, guess what? You're not going to be visiting that spine surgeon, because that's what surgeons do. They perform surgery. They don't tell you how to stay away from surgery. They're not taught that. Although they are. Don't get me wrong, like they are, but their job is to do surgery. And I'll say from this flip side, from that viewpoint, my oldest brother is a knee and hip surgeon. He does hip and knee replacements. He has to meet a certain quota per month, a certain quota per year. If he doesn't do X amount of hip surgeries, guess what? He doesn't get paid what he needs to get paid. So there's a fine line as a surgeon on who is actually the most beneficial candidate for that specific surgery. I do want to make this clear, though. With this particular patient story that I just told you, thanks for hanging in there, this is different than someone who is getting a perhaps knee replaced or a hip replaced. Because when you're working with patients who are experiencing chronic pain, it's not an orthopedic issue or a musculoskeletal issue. It's a neuromuscular issue. Nerve muscle, which then connects to the brain and how the brain interprets the pain signal, as opposed to bone or ortho, right? A joint, how the elbow bends, how the knee bends and flexes and straightens, where an actual structure, a true structure is breaking down and you can't move that knee joint. All right? You can't get up off the toilet because the knee won't move. So there's a difference when, oh, you're the perfect candidate for surgery from a chronic pain standpoint versus, oh, you're the perfect candidate for a knee replacement or an orthopedic issue. Now, my patient story that I just mentioned, this is not an orthopedic issue. This is her finding the best route or the best recipe in order for her to prevent going down that surgical route. And that's where it's at. These patient cases, these patient scenarios, when a chronic pain physician or a spinal surgeon speaks to patients like this, I get so frustrated. I'm so frustrated on that. And there are only I can only count on one hand how many patients that I work with who have to be their strongest advocate to manage what they have. And they accept that, okay, there's going to be some good and bad days, but hopefully my good or better days outweigh my bad or worse days, right? I'm hoping I don't have to take this meloxicam or hydrocodone to fall asleep because I couldn't carry or pick up my grandchild that day, or because I did and then now I'm super aggravated, right? So that's where physical therapy is so important during that patient's timeline. Yes, this can and should be a patient for life, because not only are you working with them and finding those windows of opportunity to prevent walking down that surgical route, but you're educating the crap out of them. And this patient knows her body. When you go see your primary care physician for a physical or whatever, at least when I do, Dr. Kara comes in and she's like, hey, what's up? How's life? Blah, blah, blah. What do you want today? I'm like, oh, I want blood work. Can I get this? And, okay, I'm due for my yearly pap smear cervical exam. Can we do that today? Oh, yeah, cool. Let's go. All right, well, I already fasted. You might as well just do my A1C level too. Yep, totally, right? You're in charge. When you get to that point, you are in charge of you. Surgery for chronic pain cases is the last complete resort. But have you even tried to find your lifestyle pieces that incorporate health, wellness, fitness, recovery, to find the best puzzle pieces to help you have more better days? Have you? Have you truly done that? Because surgery is the easy route. By the way, back surgery is like 70% unsuccessful. And you haven't even tried your own recipe or even had perhaps the right people in your corner. I'm not for everybody. I'm not the perfect person for everybody. That would be cool, but if I was, then I'd still be working at a hospital, right across the hall from the chronic pain center. Okay? So, if this kind of sounds like you, and you've been dealing with kind of these chronic pain symptoms, that it's not like a joint issue, it's just like interferes with your daily function. Chronic pain is just, it's a very unique experience. And trying to piece things together so that you understand what's going on from your point of view, and then also that person that you're speaking to on the other side. It could be that spine surgeon. But if that person's not going to give you an explanation, like, oh, you got your MRI. Oh, yeah, I see right here. Yeah, that's exactly what's going on. How do you know if you never really asked the appropriate questions to the patient? How long's this been going on? What have you been doing for it? Oh, yeah, physical therapy is super important. Yeah, dry needling, all for it. You don't even dry needle. You don't even physical therapy. You don't even know really what that is about, do you? I don't know. Right? So I can only vouch for the physical therapy profession that I'm so glad that this particular patient chose to work with me. And I'm all in because she's all in. And I'm going to help her find the best route and best path to walk so that she can be around with her granddaughter, so that she can do some little running with her granddaughter, so she can be able to travel, hike, stoop, and really maintain her photography skills, because that's what she likes to do. So, just to put in your mind, you're the perfect candidate for surgery. Are you? Ask the question, am I? How so, doctor? What makes me, quote, the perfect candidate? Don't be afraid to ask. It's okay. Be nice about it, right? I'm just getting fired up. So, and then finding someone who's in your corner. Of course, I'm going to bias. Find that physical therapist. Find that physical therapist that helps you understand why and the importance of maintaining health, wellness, fitness, and recovery practices, no matter what. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.